I've suggested that you really should have health promotion, disease prevention aspects to any system. I don't think there are very many complete systems like this in Kentucky, but there may be more than I know, and I'd be glad to hear about them. But if there is no connection, if there is a disconnect, this is very regrettable, because health providers should be very much interested in how to prevent these chronic diseases, the chronic diseases which will otherwise be taking up a great deal of their time and costing the state one way or another a great deal of money. At the present time, most of these prevention activities are the purview of local health departments. The trouble is the health departments generally are not functionally related to the centers of patient care. Again, a disconnect. But they should be linked in order to have communities achieve and maintain healthy lifestyles. And in turn, the healthy lifestyles are essential in reducing the incidence, morbidity, and mortality of chronic diseases exemplified by type 2 diabetes, cardiovascular disease, or some cancers. Dealing with obesity, physical inactivity, and the use of tobacco products is becoming a local, a state, and a national priority. But I would emphasize they're not standalone problems. You don't just go out and deal with obesity. You have to think about these things as part of the continuum of development of disease, and that way you can realize you have to have screening to find asymptomatic disease. Along with trying to prevent, you've got to find out how effective you are, and you have to have screening and then management of the disease in its earliest stages. Nationally, the rates for obesity, which you're probably all familiar with, and which is present in the brief which Michael Smith-Mello prepared for the center, the rates of obesity among adults have doubled since 1980 in the country, and they've tripled among children. Kentucky ranks 7th among the states in rates of obesity. The rate is 30%. 37% of Kentucky children are overweight or obese. And the effects of obesity on a person's health has been estimated to be the equivalent of aging 20 years. But how to reduce the burden of chronic disease in our communities? To do so, we have to have individual behavior change, which is obviously easier to speak about than to do. But we need to have smoking cessation or prevention, weight loss, and exercise. The findings from the study that was reported from a national nurses' health study suggests that these are remarkable numbers. 74% of cardiovascular disease cases, 82% of coronary heart disease cases, and 91% of diabetes cases could be achieved by the following obvious things: not smoking, engaging in regular physical activity, maintaining a healthy weight, eating better food, and drinking only moderate amounts of alcohol. Now, getting individuals to improve their health behavior is asking a lot. But it is imperative, and it can happen over time if communities provide the support for individuals, especially young people, who make this effort. Smoking rates for men have actually declined over the past several years in Kentucky, and a small number of communities have gone smoke-free in public places. The last one I'm aware of is Prestonsburg, which did this about 4 weeks ago. And there must be community-based help in making healthy foods available and affordable, and in developing accessible sites for walking and exercise. All elements in the community must cooperate in this supportive effort, including the schools, workplace, doctors and other health professionals, service clubs, hospitals, religious communities, homemakers group, and other extension activities, local government agencies and others. From the diagram that we have up here, you can see that the center of the target is the individual. But any change is dependent on the family, the community, which we've said includes school and workplace and religion. And this leads then to the development of public policies which come from the focus on changing the individual behavior. You cannot overstate the importance of leadership from individuals and citizens' communities who want to improve the health of their communities. We have to have community champions to make this process happen. People can make a difference, and those who are leaders in the community have demonstrated in various places that this can happen. This is, I've learned after 25 years in Kentucky along the way, I've learned that what we're talking about is a societal problem, not a medical problem. It's not a doctor issue. All of the speakers here today that we're going to be hearing from represent segments of society which are needed as partners in this effort of change at the community level. We all need to work together on these Kentucky issues, both at the community level and at the state level. I think we'll hear more about this as the day goes on. We'd look forward to your comments and questions. Thank you.